Hello, Professor and classmates. My name is Lavella de los Santos. Today, my SOAP note presentation is about the case of a 14-year-old female Caucasian born January 1st, 2020, who presents with concerns of unnoticeable spinal curvature and associated back pain. Her initial is BD. She is accompanied by her mother and both are reliable historians. The patient's chief complaint is a dull back pain that occurs after prolonged sitting or standing, along with a noticeable curve in her spine. The mother reports that she first noticed the little curve around her thoracic region of the spine about 6 months ago. Since then, there have been not many changes and she still has the curve. BD reports that the pain in her back feels like a dull ache, which majorly and primarily occurs after she has been standing or seated for a long period of time. She has a visible curvature and a rib hump on the side when she bends forward. She notes that the back pain and discomfort tend to get worse when she sits or stands for a long period but gets better when she rests. Although she has these symptoms for the last 6 months, she reports that she has not tried or received any treatment so far. She describes the pain as intermittent following activities she previously identified, such as sitting or standing for longer periods. BD denies any significant trauma or injury and reports no neurological symptoms such as numbness or tingling. She rates the pain as 3 out of 10 on the point pain scale. She reports that she is active in her school as a swimming team member. She has no history of tobacco, alcohol, or drug use. The patient has no significant medical history, surgeries, or hospitalizations. She is up to date on vaccinations. There are no known allergy and she is not on any medications. Her last menstrual period was 2 weeks ago. Her family history reveals that her mother had mild scoliosis during adolescence. No other reported joint disorders that run in the family. The patient is a minor, is not sexually active, and has no history of contraception or protection use. Her lifestyle includes a healthy diet and a regular physical activity, as she is a member of her school swimming team. She lives with her parents and has met all normal developmental milestones, performing all activities of daily living independently. For the review of systems, the patient denies any constitutional symptoms such as fever or weight changes. Cardiovascular, respiratory, gastrointestinal, and neurological reviews are unremarkable. She reports musculoskeletal discomfort related to the spinal curvature but denies joint pain or muscle weakness. On examination, the patient appears alert and oriented. Vital signs are stable with a vital signs of heart rate 72 beats per minute, blood pressure of 110/70, temperature of 98.6 Fahrenheit, respiratory rate of 16 breaths per minute, oxygen saturation of 98% on room air. The pain scale is 3 out of 10. The height is 5'4", and the weight is 120 pounds. Her BMI is 20.6. She's on 50th and 75th percentile. Her posture is slightly altered due to the spinal curvature. The Adams forward bend test is positive, indicating possible scoliosis. A spinal x-ray has been ordered for confirmation. For physical exam, the physical exam reveals a noticeable curvature of the spine with a rib hump on forward bending. Cardiovascular and respiratory exams are normal with no murmurs or respiratory distress. The musculoskeletal exam shows full range of motion in all extremities without tenderness or swelling. For the assessment, the differential diagnosis includes congenital scoliosis, postural kyphosis, and Scheuermann's disease. However, based on the age of onset, the presence of a rib hump, and the lateral curvature, the primary diagnosis is adolescent idiopathic scoliosis. Why congenital scoliosis is one of the possible diagnoses, as it is developed as a result of abnormal growth of the vertebral column during embryogenesis, leading to vertebral malformation present at birth and spinal curvature. That's according to Bagheri et al., writing in 2021. It can be ruled out in the case of BD, as she is currently 14 years old. Her mother also noticed the curvature only 6 months ago. If this was a case of congenital scoliosis, it would have been identified by the time she was 5. Second is the postural kyphosis. It is another considerable diagnosis because the condition is majorly characterized by an exaggerated forward rounding of the back due to the irregular and asymmetrical posture that deviates from normal alignment without structural constraints or generally poor posture, according to Cesirovic et al., writing in 2021. It is common in school-age children. However, it is ruled out in BD's case as there is a visible rib hump confirmed through the Adams forward bend test and the specific lateral curvature observed. Schumann's disease can also be considered as a possible diagnosis that leads to a noticeable curvature and back pain that is a result of being a more rigid form of kyphosis that develops due to uneven vertebral growth, according to said Ali et al., writing in 2022. However, it is dismissed in BD's case rather than it is being on the lateral plane or the side bending, as with the various types of scoliosis. It is more pronounced in the sagittal plane or forward bending. The primary diagnosis is adolescent idiopathic scoliosis. This diagnosis is based on the symptoms and history that the patient presented, as well as Adam's forward bend test examination. However, the other differentials can be considered because they present overlapping manifestations. For the plan, diagnosis studies would include spinal X-ray to confirm the diagnosis of scoliosis, according to Kusnia et al., writing in 2020. The patient will also be referred to an orthopedic specialist for a more comprehensive diagnosis of scoliosis and of a more specialized management plan. For the treatment, physical therapy upon the confirmation of scoliosis will be utilized to improve the patient's muscle imbalances and improve posture. The patient will also be provided with information on other possible methods of managing the condition upon confirmation, including back brace and surgery, according to Adai et al., writing in 2020, and Grivas et al., writing in 2022. The patient and her mother were informed about adolescent idiopathic scoliosis and treatment options, the importance of regular follow-ups to monitor progression and adjust treatments, maintaining good posture and strength training for back muscles, self-care as a key aspect for managing the condition, according to Dufvenberg et al., writing in 2021, continuing on swimming exercises. They were also educated on surgical options, including potential complications, according to Almoher et al., writing in 2020, and post-surgical pain management, according to Navarrete Sampagna et al., writing in 2019. Brace treatment, including factors that may affect its effectiveness, such as premature removal, rapid growth, and poor bone development, according to Hawari et al., writing in 2019. Instructions on brace management were also provided. For follow-up plan, the patient is scheduled to return to the clinic in 4 weeks for a follow-up, which will focus on evaluating her response to the interventions and adjusting the treatment plan as necessary. Based on the results of the X-ray, she will be referred to a scoliosis specialist. Additionally, both the patient and her mother have been referred to a mental health support program as outlined by Essex et al., writing in 2022. The diagnosis and treatment of adolescent idiopathic scoliosis is significantly impact the physical and mental health of adolescents and their families. In summary, the patient presents with symptoms consistent with adolescent idiopathic scoliosis. Our plan focuses on confirming the diagnosis, initiating appropriate treatment, and providing comprehensive education and support to the patient and her family. Thank you so much for your attention, and I welcome any feedback from all of you. Thank you so much.